Okay, hi you guys. Welcome back. Welcome to Healthy Living. This is Marquita. And in order to contact me, you can go to marquita.com or healthyliving.company. Sorry for the delay, but the system kicked us out. It's busy traffic right now, which is understandable. So anyway, there's different items there on my website. There's Kita's Egg Toast, Gumbo, Arbonne products. You can click on those links and investigate that if you need to have any of the food products. You have to let me know so I can special order it for you. And with the gumbo comes rice and hot water cornbread. Okay, so what we're going to do is get to the coronavirus update. The producer of the show is T-Jams. That's T-J-A-M-Z. And you can reach him at tjamsmusic.com. There he has a whole host of songs you can write lyrics to, send him messages back to him as well. He does web design. You can contact us both here at the Next Level Studios, and that's 310-549-1113, 310-549-1113. Now, I'm a nurse, and I'm a public health nurse, and I work with LA County, just so you know. The information that you're going to be receiving, it comes from the CDC website, Cal OSHA website, also from the Worldometer web page is where I get my current numbers on what's going on with the coronavirus. I also go to USA Today News. Current updates as of today, actually an hour ago. In the world, we have 718,656 cases. Deaths are 33,891 and 150,918 cases. These are patients that have actually survived. So when we get down into the show, I'll tell you how to take care of yourself as well. Now, it looks like the USA is leading down the number of cases. We now have more than China. We have 139,745. Italy is leading in the actual deaths. They have 10,779. This is very grim, but it's the truth. So I'm going to tell you the truth all day long. Now, most of the time, you say 75 to 80%. If you get infected, you have mild symptoms, but some people do advance from moderate to death. So that does happen. Having symptoms such as cough, sneezing, fever. According to the World Organization on Wednesday, 3/11, they declared it a pandemic. That means that it is worldwide. Now, this started in Wuhan, China, if you don't know, in December 2019 that we know of. Remember, China was late talking to us about it. It has spread to 199 countries and 2 international. This is worldwide. That's why it's a pandemic. Now, the new coronavirus, which is what we have right now, is part of the, this is not the first coronavirus, but this is a new one. This SARS, as they call it, is severe acute respiratory syndrome. It's a virus. And then there's also MERS, which is the Middle Eastern respiratory syndrome virus. Those are also coronaviruses, but we have the new one now. But all 3 of them originated from bats. Yes, bats. At first, they thought it was from live markets with live animals and fish, so they thought it was animal to person. But later, they figured out it was from person to person spread because it was happening outside of Wuhan, China as well, and it was into the United States. So it became international. Illness ranged from, like I said, from mild to moderate to even death. And that's what we don't want to hear. Now, who's more vulnerable? The ones that are more vulnerable are the ones that are 55 and older, and they have different people like myself with chronic diseases. You know, you're talking about hypertension, heart disease, chronic respiratory illness, diseases, also asthma, cancer, any autoimmune suppressive disorder, if you was on chemotherapy, HIV, any of those autoimmunes that makes you higher, also diabetes, makes you more susceptible to the coronavirus. Now, there's a national shortage of the COVID tests. So they're working on that. But as of March 5th, there's supposed to be more available, and your doctor would have to order it for you. He has to write a prescription. And even though you may have some of the symptoms, it doesn't guarantee that you're going to get tested. So now, if you don't have a provider and you need a provider, call 211. That'll help you find a provider. All tests are now free, so they cannot charge you to be tested for the coronavirus. Some of the symptoms include coughing, sneezing, fever, shortness of breath. Some people say they feel fatigue. Some people actually are vomiting. So there's different symptoms, but those are kind of the common symptoms. High priority testing, of course, is for the healthcare workers, meaning us, like nurses, doctors, people within the hospitals and clinics, the people, EMTs, people bringing the patients to the hospital. The police are now getting, everybody's getting cases of testing positive with the coronavirus. But now we've been given priority, which is really nice because we are taking care of you. So we have to stay healthy to take care of you. And if we're not healthy, then you're not going to be healthy. So there's more tests being available. It was really strict before and limiting because they had limited tests. Everything's based on limited. So now that we're getting more tests available, then we can do more tests. Now, per the New England Journal of Medicine, aerosol and surface stability for SARS, like say for instance, when you cough as aerosols, they're droplets, they're airborne, right? So they settle on cardboard, they settle on copper, stainless steel, and plastic. So for aerosol, it stays in the air for about 3 hours. They said at least 3 hours. So you can walk into it and get the coronavirus. On plastic, it stays up to 72 hours. Stainless steel, 48 hours. Cardboard is 24 hours. And copper is the least. It stays on there for about 4 hours. So when you get your products from the stores or whatever, you want to make sure that you either cleaning the packages, but you definitely got to wash your hands. Always wash your hands first. Now, the epidemiologists and characteristic of this virus probably arise from other factors, including high viral loads. Viral loads is the number of viruses, particles that you get into your system, loading up in the upper respiratory tract. Potential person infected, they can shed and transmit the virus while asymptomatic. And this is why a lot of people now, they thought they were invincible and didn't think it wouldn't bother them because they're walking around asymptomatic. And you can still, when you're asymptomatic, you can still pass on the coronavirus. So young people, don't be hard-headed. Stay home. Okay, results have indicated that aerosol and formites transmit the SARS-2, that's the coronavirus 2, since the virus remains vulnerable and infectious in aerosol for hours and surfaces up to days, depending on the type of shed, meaning what that person who has the coronavirus breathes out, even exhaling, talking, sneezing, coughing. You can get all of that from that, or different surfaces by touching your eyes, your nose, and your mouth. So the viral load, like I said, is measured by the particular particles that are present in each individual. Now, according to the CBM, the Center for Evidence-Based Medicine webpage, healthcare workers are at a higher risk for getting the COVID-19, higher risk, and potentially being more severe due to multiple exposures, which can increase your viral load, meaning how many viral particles you have in your system. Healthcare workers must be protected. We must be protected with all the proper PPE. You do have the right to refuse assignments if you don't have all your proper PPE. If you are working with a patient under investigation, or definitely a patient with the coronavirus, you need to have all your PPE. Now, personal protective equipment. Now, because there's a shortage, the hospitals were making nurses wear surgical masks. Surgical masks does not help you from the coronavirus. It does not help you. Surgical masks were made initially to protect the wearer from coughing and sneezing on other people, but it does not protect you if you're trying to prevent yourself from getting it. So the sad part that's going on in the hospitals and clinics and everywhere else, because there is a shortage, is they're making the nurses reuse, wash the N95s, and that's not really appropriate. It's not the safest. It's not the guidelines for Cal OSHA. So in order to be proper PPE, personal protective equipment, you need your N95 mask, which is fit tested. You would need your goggles, You would need a face shield to cover, even including the sides of your face. And you need a gown to cover your body. So these are all the things that you would need. Now they do have other jumpsuits that covers even up to your neck, which is a better way to protect us from the coronavirus. Now, how you clean these surfaces is, you like I said, you wash your hand. You can spray it with disinfectant the packages, but always wash your hands. Always wash your hands. If you don't have it, you can use a strong vinegar and you can clean it and use it that way as well. But you always wash your hands. Remember that. Now, per the helpline website, microbiologists say there's no need to panic about the packages and things on surfaces. You have to just make sure you wash your hands and be careful. Another thing I wanted to tell you about is money. Yeah, you have to, if you don't wash your hands and don't be careful, you can give yourself the coronavirus by touching your eyes, nose, and mouth. Also beware of money. Money is very contaminated as well because it goes and it interchanges several different hands. So while you're out, you get your money, you can have your gloves on. Gloves is the other part of the personal protective gear. And you can put your money inside the plastic bag. And when you get home, make sure that you wash your hands. And these actually can be washed as well, the bills can. Once you touch it, you have to make sure if you touch something and you have gloves on, you have to remove the gloves and throw them away. And then you have to wash your hands. So you don't want to keep transferring the same germs to everything. You have to change your gloves, throw them away, and you have to wash your hands. Okay. Now, fact check. There's some information out there talking about you shouldn't use ibuprofen because they said in the patients that have died, they had high levels of ibuprofen in their system. So there's a lot of scientists that are saying you shouldn't take ibuprofen if you have the coronavirus. Now, per Anthony Fauci, who's been the doctor that's on TV all the time with Trump, he's infectious director for CDC. He says that he's not aware that the ibuprofen is wrong or is not wrong. So there's no science right now to prove that. So the best thing to do is you can always be safe instead of sorry. I'm going to use Tylenol from now on. And then also make sure you consult with your primary doctor to discuss this issue, whether or not you should be continuing to take it or they're going to stop you and put you on Tylenol. First, Dr. Fauci says that Tylenol is the best to relieve fever. It's always been the primary for relieving fever. So he believes that the Tylenol will be better for that purpose since most of the coronavirus patients have elevated fevers. So that's the take on the part about ibuprofen. Now, okay, make sure you talk to your doctor before stopping or changing any medication. Always speak to your provider. Now, I think we need to add, these are some of the things where I think things go wrong in our system, things that fail us in our systems. Per Albert Einstein, there's 3 great forces that rule the world: stupidity, fear, and greed. Now, I think we need to add lies and the lack of qualified real medical doctors in positions that should be in those positions instead of PhDs. Also, bad politicians that are unqualified. People put them in positions because they know who they are or because they have money. That's why our country right now is in such a state of emergency, because we have people in power that are not truly qualified to be in power, making bad decisions. And it's political. Remember, political is just another word to say it's about the money, because it's all about the money. It takes money to buy the supplies. We know as nurses we need our supplies. Also, our healthcare workers need the supplies. Now, per Medium.com, this disturbance is for all healthcare workers, meaning anybody who's in clinics, hospitals, in the home setting, wherever you are, you're impacted. They are Everyone has been shocked and they are fearful of retaliation to expose the risk. So they take on assignments because they don't want the consequences of possibly being fired. But what I'm saying, this is a dirty secret, inconvenient truth of what really is happening behind the scenes to come now to light. Now, I've been telling you about the truth for the last 4 weeks. You can check some of my prior shows that was tagged by CDC. Now, limit exceptionals for the hospitals are letting staff wear protective brought from home. Some hospitals don't want you to bring or create your own mask or bring anything from home, even though you don't have anything when you get to work. Now, some hospitals will allow you to do that, but other voices are being drowned out. As you can see, the nurses and the different doctors on the internet that are saying that they don't have the right protective equipment. So we're being slaughtered. Our voices, they don't want to go to the hospitals to do the interviews of the actual nurses and doctors and healthcare workers that are actually on the front line. That's where the media needs to be, not with the president and not with the Congress. They need to be at the hospitals so they can see what's going on. Now, the coronavirus is known to be airborne. China, Italy, South Korea, they all know it. Also, the World Health Organization, they all know that this is airborne. CDC also knew that it was airborne at first, and then they changed it to drop it down to droplets. They decreased the standards to reduce it from airborne to droplets to reflect the small supply of PPE, personal protective equipment, available to healthcare workers. Now, our lives are more important than that. It should not be adjusted just because you don't have the supplies. Now, a few days later, CDC amended their recommendation and now also said you can include bandanas, scarves at the last results for protection. Now, other countries are having their healthcare employees suit up in full hazmat gear. You know, that's the whole thing with the head, the shield, the whole jumpsuit, everything, right? And then some experts, infectious governments and organizations is offering recommendations of just the bandana. In the streets of China, their hazmat teams are fully covered. They're cleaning the streets, and these are just people cleaning the streets. Why not have that for your staff that's taking care of your patients? So the nurses and the doctors, we're all exposed to this. So why shouldn't we have the same kind of gear to protect our lives? We are vulnerable. Currently, the healthcare workers are now being told to reuse disposable items for days with multiple patients. Now, back in 2019, if a nurse was to do that, she would get fired, or she definitely would be disciplined, and they would be calling the board to report them for their license. This is directly contributing to the spread of the virus of other patients and staff. Many healthcare workers are forbidden to wear masks unless they are with a patient that is suspected of confirmed or having coronavirus. Meanwhile, studies show that a large number of patients, they have the virus, they are asymptomatic. So just like we had a situation where we had a meeting about a week ago where that person knew that they were being tested for the coronavirus, but you chose to come to the meeting anyway to expose us. That's inappropriate. You should let your peers know who you are so that they can then self-quarantine or know what they need to do to protect themselves. Now, it is less. Now, they also state that it's less ethical administrators, these are the bad ones, are calling their healthcare workers that is telling them that that's a HIPAA violation, that they can't tell them who the person was that tested positive. So they don't know who they took care of, and they don't know if they were exposed because the administrators won't tell them who the person is. That is not a HIPAA violation. That is considered very ruthless and criminal because you're endangering that person. So it's not a HIPAA violation. Everyone should be informed on how they got exposed to the coronavirus. This is untrue. It's negligent and criminally reckless if they don't tell you that you were exposed to the coronavirus. Healthcare workers are instructed to wear the same mask for several days, the same mask across all their patients. It is particularly impossible to remove the mask and then reuse them without contaminating yourself. That's why you don't do it. Many workers are being issued a paper bag or a plastic bag, and they're instructed to store their masks in there between shifts for a whole week. The same doggone mask all day long for the whole week, and you to put it in a paper bag or a plastic bag, and you told to reuse it. This is what's happening in New York now and other different hospitals. Now, I work for LA County. We have huge county hospitals like LAC USC. We have Harbor UCLA. We have Olive, we have the Inland Empire, and many other large facilities that perform the poor standards of not providing all their required PPE, personal protective equipment, for all their healthcare workers, insisting on wearing surgical masks, reusing N95 respirators due to the health. So this is what we're being told as well in LA County. We have more than 11 million population. We should never do that. We should follow the standards, and we should do what we're supposed to do to protect our workers, because our workers get more exposed to the virus, so they're going to have more viral particles, so that's going to make them sicker and increase their possibility of even dying. Now, because of our union, SEIU 721, yay, they're fighting for us. And you know what, nurses? We are the union, but our union leaders and the nurses, we're all fighting with management, who now have agreed as of last week to increase their standards to allow us to have the appropriate personal protective equipment. But they had to order it, so it's probably about 2 weeks away. But all I'm saying to this is for everybody to keep fighting for your rights, because this is for you and your family. Now, we as healthcare workers have the right to know who tested positive. We don't want to be positive. We don't want to be sick, but we are nurses. We go and we take care of the sick. But we want our administration to properly protect us so we don't get sick. So now what we do is we have to pray every day, all day, to make sure that we all stay healthy, so then we can make sure you guys stay healthy. So please stay home and stay healthy, and so we stay healthy for the future. Now, I have this sad announcement to say. I know you guys seen this on the internet, but we have lost one of our RNs in New York. It was Chaos Kelly. He's assistant nurse manager. He worked at Mount Sinai in New York, and his death related to a lack of protective equipment. Now, management can say all they want, but we all know what it really is. According to his nurse peers, the hospital says that they've been having issues with low protective equipment for more than a year, completely not prepared for normal times, and definitely not prepared for the pandemic. Per Annie Lee, who's another peer of Kelly's, she said that he was wearing garbage bags to make into a gown to protect himself so he can continue to take care of patients. Nobody should have to die because they don't have the personal protective equipment. Nobody should get sick because they don't have all the proper personal protective equipment. Now, according to MSN News, Dr. Ming Lin, he's an ER doctor that's at Peace Health St. Joseph Medical Center in Bellingham, and he worked there for 17 years. And do you know, about 20 minutes before his shift, they fired him on Friday. Why? Because he was making statements on Facebook and the media, repeatedly criticizing what he saw as sluggish response to the threat by the hospital administrators, not bringing in slow responses to screening the visitors, negligence in not testing staff, wrong to reply to companies that were taking 10 days to process the coronavirus test results. So he also was fighting diligently to make sure that the nurses had the proper protective equipment. Now, after that hit the media, oh, the hospital administrators are backpedaling right now. Oh, we didn't fire him. We're just going to make sure he gets to a different location. Well, who wants to be reassigned? That's not a good feeling. He's a good doctor, and he's fighting for the nurses, and he's speaking out. That should never happen. So thank you very much, Dr. Lynn, for fighting for your staff. These are many healthcare worker deaths in case, but no one is collecting that data. Now, next week's show, I will do the anonymous task of trying to do the totals for the deaths and cases for healthcare workers, but that'll be on the next show. Now, according to Dr. Maria Kerfhub, on March 16th and the 23rd, she's the head of the WHO, which is the World Health Organization. Coronavirus spreads through humans, through contacts, through droplets, carried through sneezing, coughing, and germs on an inanimate object. The coronavirus can go airborne, stand suspended in the air, depending on the factors such as heat and humidity. So everybody keeps saying it's airborne. And it is. It always has been. It's airborne. Okay? Respiratory protection is mandatory to protect healthcare employees from airborne infectious diseases, including the new pathogen airborne coronavirus. All healthcare workers should be protected wherever they work. It's the management's responsibility to make sure that workers stay safe. It is important that employees prevent harmful exposure to and protect their workers, their families, and their communities. Therefore, employees must provide appropriate respiratory protection at all times when other controls don't eliminate employees from exposure to airborne infectious disease. Respirators must have filters that remove at least 95% of airborne particles, hence why it says N95. There is some that's N99. That's even a greater percentage of protection. It must be labeled and approved by the U.S. National Institute of Occupational Safety and Health. Under Cal OSHA, aerosol transmitted disease, Standard Title 8, Section 5199, a novel virus such as the coronavirus, the virus called, now they call it COVID-19, is considered an airborne infectious disease, and control measures should, such as the use of airborne infection oxygen, respiratory protection, is required. Warning! Surgical masks and those do not protect you. It will not protect you. Surgical masks. Only protection you will get from a respirator, an N95. Do not protect persons from airborne infectious disease. Okay, so let's not, come on, administrators, wake up. When the nurses stop showing up to work, then what? They'll wake up, right? Now, workers should not be used. We keep reusing the respirators. Management, hopefully they're learning that they now have to get the information, the respirators and the appropriate PPE into the hospitals, clinics, medical office, for nurses that are going out on home visits like myself. That's what I do for abused kids or the district nurses. We have different types of nurses, but we all have contact with our different clients and patients. Now, also, we have to make sure that we are washing our hands frequently. Remind our family and friends as well. Now, the respirators are in short supply. We know that. It's a national shortage because Our managers didn't prepare. They didn't stockpile like they should have done. Now, how do you take care of yourself at home? Now, how do you take care of yourself at home? If you have the chronic illnesses that I mentioned earlier, like the heart disease, lung disease, diabetes, cancer, autoimmune, all of those different diseases, you can ask to be quarantined as per state guidelines. Another thing you can do, the best way to prevent from exposure to virus, stay home. Stay home. Don't go in the street. Stay home. Tell your children, stay home. Because that's how it gets spread from person to person. So you want to stay home. If you do have to go out for, emergencies, you want to make sure you stay 6 feet away. And if someone's not following, you have the right to say, hey, back up. 6 feet away. You have to speak up for your own health. So there are some people out there who are not listening. They're sneezing, they're coughing, they're exhaling and talking. Remember, you can still get that from exhaling and talking. So you need to back them up 6 feet or more. I think it should be 8 feet or more, or 10 feet. You want to make sure you clean your hands often. Wash your hands for at least 20 seconds. You can have the kids, you can sing Twinkle, Twinkle, Little Star, or you can sing Happy Birthday twice. Gloria Gaynor also has her stuff where you can sing her song, I Will Survive. Just get to make sure you're washing it for at least 20 seconds. Now, if you're in the public, if you're sneezing the tissue, use respiratory etiquette. Sneeze in the tissue, throw it away, wash your hands. Or you can sneeze inside your elbow or cough inside your elbow. You don't want to do it on your hand because then you're touching different things. So that you don't want. If you don't have soap and water, you can use a hand sanitizer that is at least 60% or stronger. And do the same thing. You want to keep washing and rubbing because it's all about friction. That's what gets rid of the germs. But you want to make sure that the hand sanitizer is completely dry. You don't want to do it a couple of times and then wipe it on your hand, on your clothes or something. You want to wash and keep rubbing until it's totally dry. You want to make sure that you avoid touching your eyes, your nose, and your mouth because the virus has to get into your respiratory system. So it can get into your eyes, your nose, on into your sinuses, down your trachea, down into your lungs. So you want to keep that from happening. So you want to make sure when you're out, and I know sometimes nurses, I do it too. When I'm tired or frustrated or overworked, first thing I want to do is rub my eyes or my nose or something. So try to keep your hands off your face as much as possible because that's how you can spread it. Teach your kids that too. Avoid close contact, like I said, at least 6 feet apart. This is especially important for the people who are at high risk, like the 65 or older, the people with chronic conditions. If you're sick, stay at home. Don't be going out making other people sick. You don't want to make somebody else more vulnerable because you're sick. Stay at home. Okay, so then the other thing is, like I said, remember, cover your mouth and nose. And I know sometimes when you get really, really sick, if you know that you have a hard time to get your tissue or your mouth or nose into your elbow, then you need to have on a surgical mask if you're around people. Now, that will help you if you're sick and you're coughing and sneezing. That will help prevent you from spreading it and dropping it everywhere because we don't want your germs, right? Now, there are different types of alcohols you can make. Actually, no. You want to do either 60 to 95. Okay. Now, there's also different cleaners and disinfectant you can use. You want to make sure that you clean typical things. Like I said, like I mentioned to you, like the money. We don't think about that every day. But your money, you things like your keys, you don't think about those things, but that's what you use every day. And look how many times you can touch that. Light switches, countertops, handles, desks, phones, keyboards, toilets, especially in the bathroom. Because, everything goes down in the bathroom, so that's just nasty anyway. So you want to make sure you keep that clean as well. Make sure you clean often. Use detergent and soap water, and you can use disinfectant. You can use disinfectant that are EPA registered. Household disinfectants will work. You have to be careful out there that you're not getting the products that are not very helpful for you to help disinfect anything. You got to be careful all these other things that they're developing and trying to take advantage of you for. Some people, you know, they're doing stuff and it was burning their hands from the hand sanitizer. So please read the ingredients and make sure that they're safe. Now, if you want to make your own at home, you can use bleach. You can mix 5 tablespoons or 1/3 cup of bleach per gallon, or 4 teaspoons of bleach in 1 quart of water. Follow whatever the manufacturer instructions are, because every manufacturer is different. Check to ensure that the product is not past the expiration date. That's important too. Now, it's very important to never mix household bleach and ammonia together. It starts this heat cloud and it burns and it's very toxic to you. So you don't want to do that. Don't mix chemicals. Now, there's other alcohol solutions, you know, at least 60% or higher. Some say 65, some say 70. But at least from 60 up, you should be okay. That's what they're recommending. Now, there's other different products for disinfectant. You have to go on, you can look for EPA approved different products to make sure that they can kill the coronavirus. Remember, this is a different bug that's really an idiot. It's mega. So you have to make sure you have the right thing that's going to kill the viruses. Now, other methods to protect yourself. Now, like myself, I like to use, you know, to clear my sinuses, I use my Neti Med. And, you know, you just put the water and you have the bottle and you have a pack. It's like sodium and sodium bicarbonate. And there's a line there with instructions. So you mix it and you literally just hold it against your nostril, go over the sink, open your mouth, and you squirt it in, and it should come out through the other side. Now, I know it doesn't sound that great, but this stuff works. And then you have to make sure you're following the instructions for the proper cleaning. You want to make sure it's clean, okay? Now, another thing is that you want to make sure that you keep all your prescriptions, make sure they're available, whether it's your inhaler, whether it's your nebulizer, your routine prescriptions. You want to make sure you keep all that available. Also, nutrition-wise, food with zinc, blackberries. They have cashews, almonds, avocados, broccoli. You want to make sure you eat zinc products that have it. It helps to build your immune system. You can also take the zinc supplement if needed. And then also, you want to make sure that you get plenty of sleep, because sleep, that's when your body reboots. So you want to make sure your body reboots. So you need to get sleep, and it has to be uninterrupted sleep. Having a hard time sleeping, you can try melatonin. It works very well for me. When I can't sleep, I take some melatonin. Exercise, we're going to do that in a little bit. I'm going to do some demonstration. We're going to take a break. Make sure you guys exercise. We're going to take a break, and we'll be back in a couple of minutes. So this is when I actually do the demonstration of easy exercise that you can do while you're sitting, standing, or lying. So there's no excuse not to exercise. It also helps to release stress. Okay, I'll see you in a couple of minutes.
Abracadabra, I love that. Check 1 2 1 2, check 1 2. Check 1 2 1 2, check 1 2 1 2. Check 1 2 1 2. Check 1 2. Yeah, I like to say this groove shit. This is how I feel when I'm grooving, I'm rolling down the street sometimes. I'm at the corner store, pass me my liquor though. Give me on the streets, let me tell you, can you feel me though? Skipping to the beats, let me tell you, you be moving slow. You can't play me, cause I heard you go. Rock, nah, can't stop, here I go, watch the block. Crazy, man, can't kill me when I go and stop. I'm the extra man, you can't be. See myself on the streets when you see me. Then the washing for food to eat. But you got to feed me when you see me. Whatever I do for the hunger and the thirst. Whatever I do, man, it gotta come first. Some real shit I spit when I'm on my grind. Hot dollar when you're skipping, man, I'm losing my mind. I'm that crazy psycho, aqua, visco, dot. Let me tell you something, now, nigga, I was born and watch the block, bitch. It's crazy out there and change phase me. These niggas can't play me when I play, B. They get guilty like a cheap bone. Let me tell you something, bitch, and try to fake me. These niggas can't play me when it's crazy. I'm getting paid out there trying to play me. I know it's regular. I get my money out there, I'll be chasing competitors. I get money when I chase, boy, watch my face. I'm leaving nothing but a bad taste steady in my break south, break north. Now I know where you at. Think you say so when I'm at, man, I'm chasing your rat. Looking for the cheese and believe you know where I'm at. See, you know what I'm talking now, you can't even fake me. Showtime, I bust around all the time, I lose my mind. Where you at, boy? I'm over there in the county line. Here's my issue, what is my issue? Nah, I'ma tell you some money, don't need no tissue. Ain't no crying, over here straight soul. So let me tell you right now what you know. I blow like I blow, never really quit. I'm still stay crazy when I'm doing this shit. Like abracadabra, watch all this magic. It's still some boo-boo shit, got the magic. Save me, hey. These niggas can't play me when it's crazy. I'm getting paid out there trying to play me. I know it's regular. I get my money out there, I'll be chasing competitors. I get the showtime, major that. As long as my hat is back. You never catch me slipping when I'm on the microphone. I'm always on, let me tell you something when I'm on. Where you at, B? I see you sitting in the chair looking at me. And what you looking for? When the fuck you looking at the show? I'm the regular competitor. My brain never change when I'm on the mic. That kind of brother, when you know I'm tight. Watch the shit when I freestyle, I do not write. I'm that nigga coming straight from the closet. Monster, ooh, no, really don't bother. Keep it on going, let me tell you, don't cry. I keep it on going, cause I keep on fly. Try and keep going, tick, tick, tick. Where you at, chill with some of that shit. Got you all going straight on the height. This how it is when you're free on the mic. Free save me, hey. These niggas can't play me when it's crazy. I'm getting paid out there trying to play me. I know it's regular. I get my money out there, I'll be chasing competitors. I get them save me, hey. These niggas can't play me when it's crazy. I'm getting paid out there trying to play me. I know it's regular. I get my money out there, I'll be chasing competitors. I get them.
Okay, hi you guys, welcome back. So remember I said I was going to show you how to do some exercises, whether you're lying, sitting, or standing. Now this is a great way to release stress. It's also a great way to lose weight. So no matter where you are, I'm going to show you. So when you're on a couch or in a bed, these are called sit-ups. So you can put your back right next to your arm of your couch or your head of your bedboard, and you can do your sit-ups. Go down and up, use your arms, right, to go with you. Then when you get a little better, you move down a little further, always holding your abs. And you can do 3 sets of 10s or you can do 3 sets of 5, depending on where you are. And then you can go all the way, right? Remember, always hold your ab in when you're coming up. Now, there's another thing you can add to it. You can bring your knees up to add extra to that. So that helps you with the whole ab and includes your legs. Something else you can do. Now, to finish with the laying down exercises, remember I said you can do this when you're in the bed or on the couch because there's no excuse not to exercise. So if you need a little help, you can use these retention bands And you can help yourself pull up if you're not used to exercising. So you can help pull your leg up. And remember, always keep your abs tight. Hold them in, right? Keep your back to the floor. If you don't need this, then you can do it on your own. You can alternate. And then you can do 2 at a time. Remember, hold your abs in whenever you do it. Then you can also open, because, you know, a lot of people have a lot of fat right in this inner part of the leg, right? Right here. So you open, and you just open and close. And that helps with that big piece of fat that's right in there, right? I know you guys know what I'm talking about. So then when you get really good, you can lift up, go higher and higher, hold your abs in, but you got to go where you can go when you get started, okay? That's a little more advanced, but I'm showing you how to progress it, okay? Now, since we're here, another thing you can do that's good for your back is pelvic lifts, tilts. You put your palms face down, right? And then you lift up. Hold your ab. You can hold it for a count of 30, or you can do 3 sets of 10s, or you can do 3 sets of 5. Depends on what you know, how you feel. But this is good for your back at the end as well, is to hold it. Okay, and it gets your core stronger. Hold your ab in, right? Now, another thing you can do scissors. Crossing over. Remember, hold your ab in. Hold your ab in. You can do another thing that's good for your back, but if you're not used to it, then you have to do it slowly. I should have changed into my shorts. But anyway, you just lean one leg to the side, right? Wherever you can go until you can go all the way. Should have my shorts on. So anyway, all the way without this leg moving. The object is to stretch this leg out, and it stretches your back, right? And you want to do both sides. Don't just do one side. Do both sides. And then you can try going with both legs to the side, right? And then you go until you can go as far as you can go. Now this stretches your back out really well in the end. Is to just lay like this at the end. This is good for that, okay? But it's also a good exercise for your love handles, okay? All that stuff on the side. Okay, Anthony, put this back on for me. Hold on, let me adjust the mic. Okay, so you can do those things. Now, you can also lift. You can lift 1 at a time. You can lift 2. You can do multiples. And then you can do higher. Always hold your ab in though. And if you're just starting, you can do 1. If you can't go all the way, go where you can go. The object is to get started. And it does work. So don't think that it doesn't. Okay, now, you can also get another resistance band and tie it. And you put it just above your knee, which I probably will be doing more of these when I have my knee surgery. So, the most important thing about this one is you want to make sure that you roll your hip forward. So how I remind myself of that is I put my hand forward, and then you can just open your leg. Hold it 3 sets of 10 or 3 sets of 5, or you can do up and down. Then, make sure the hip is over. Hold your ab in. You can stick your leg out. You can hold it, or you can do your 3 sets of 5 or 10, right? Hold your ab in, and then you can go to the back. Make sure that hip is rolled over, okay? And you can do the same thing. You can hold it, or do 3 sets of 5 or 10. And do it on both sides. Remember, both sides. Don't be cheating. As you can see, it works. I sweat. Okay, there's another one that you can do. You turn on your back, and then what you want to do is bring your heels to your butt as far as you can. So you bring it up. That's good for your lower back, the back of your thighs, and your buttocks. So you know all that fat that be hanging out of your bra and your shirt? That's what this helps for. So you just do this, and it will definitely help you. I guarantee you. And if you can't go all the way, your knee hurts, then go where you can go. It still will exercise, whether you're low, medium, or you're high. Okay? So do those. Now, let's do some standing. Remember I said you're going to do lying, sitting, and standing. Now, and get your kids to do this with you. I mean, they love to exercise. They'll do whatever you do. So, the important thing right now is to develop that core, meaning your abs, your stomach, and your buttocks and your thighs, right? So, what you can do is get a chair for the beginning, because you got to learn how to hold yourself up for at least 30 seconds. And don't feel bad, because I couldn't do it at first either. So, you got to keep trying. So, you're going to have to hold on, which is okay until you get stronger, right? So do that to help develop your core, because you got to use your thighs, your buttocks, and your abs to hold you together, right? Now, make sure you're doing the other leg as well. This one, I had to get surgery on. It's a full-torn meniscus, so I'm not as good because it hurts, right? But even if you have pain, you should still keep moving, because if you don't move, the pain is worse. So you have to start moving, okay? Now, another thing you can do while you're standing is leg lifts, right? Whether it's low, medium, or high. Doesn't matter. And remember, both sides. Always hold your ab in, right? Now, some more standing. Now, I want to show you how to do a squat that's good for your knees, that protects your knees, because you're going to sit off your knees. So I'm going to show you from the side so you see what I'm talking about. But you're going to have a broad stand. So you stand broad, and what you're going to do is stick your butt out as you go down. It's like you're going to sit down, right? So you sit with your butt and go down. You see that? Your butt, because see, that moves the weight off of your knees. So that's important that you stick the butt out. Stick the butt out and go down. That's your squats. Another thing you can do when you're at work, as long as your chair is secure, if you're not strong yet, because you want to make sure the chair doesn't move. So when you're at work, when you go up and down, what are those? Those are squats, right? And if you have knee problems, remember what I said. Stick your butt out first and sit down. It's the same premise. So you can do that while you're on a break at work. Another thing you can do, let's do standing still. We're going to do what I call standing sit-ups. Now, if you have a back problem, you have to make sure you move slowly, because you get a back spasm. I have back problems, so you go slowly. So you keep your feet apart, and you go down slowly, whether it's to your knees, to your calves, to your ankles, the top of your foot, or to the floor. Now, at the end of your exercises, man, is this good to stretch your back out. Just hold it there. Now, for this, also I want you to go to the sides. So, slowly. So you're going to go to the front, and then you're going to go to the side. That's for those love handles, right? You're not twisting like this. You're moving yourself to the side. And then mix it up, right? You have to do it slowly. If you have back problems. If you don't have back problems, you don't have nothing to worry about, okay? Now, you can get some weights, and you can march in place, do your lifts. If you can't lift too high, then just lift low until you can get a little higher and a little higher, right? And then you can get faster. So you just have to start moving. That's the important thing, is to start moving, right? Now, another thing, if you don't have weights, you can use water bottles. Now, there's one more thing about the calf lift. You can do this while you're brushing your teeth. You just lift up, and you can wind up doing about 80 to 100 in the morning while you're brushing your teeth. That's good for your calves, your ankles, and your feet. And you're brushing your teeth. Isn't that amazing? That's absolutely amazing. So, that's what nurses call secondhand duties. Okay. Now, let's do some exercises that we can do while we're sitting. Okay. Now, for those arms, you know those flabby arms that you have, right? So you can get a band tied in the middle. You can put one palm flat down. You put this one on the armrest, and you just go up and down. If you have shoulder problems. If you don't, you can put it down here too. Whatever's more comfortable for you, you can do that. And then you rotate, do the same thing, right? Now, another thing you can do is stretch. You can support your arms on the armrest if you have shoulder problems. Then you can let it back. You can do 3 sets of 10s or 3 sets of 5. Trust me, you're going to feel it. You're going to feel it. And then make sure when you do that, you're retracting slowly, because that really engages the muscles, okay? Now, another thing you can do with your weights or your water bottles or your canned vegetables or whatever you have, it don't really matter, right? You can do some little curls. If you have shoulder problems, support your arms on the chair, which is perfectly okay. Now, if you do have shoulder problems for the back of your arm, you can lift up to like right here, and then you go up this way. You can do that too. If you don't have any problems, then you can go all the way back and lift up. I can't because I have shoulder problems. Now, remember the sit-ups. Sitting, standing, or lying, right? So you open up, you do the same thing. It's a little less distance from the chair than standing. So if you're a beginner, you might want to start in the chair. It's up to you. You would have to judge, but I just want you to get started. So you do the same premise. You go to the floor. 3 sets of 5s or 3 sets of 10s, right? And then you got to go to the side. Now don't cheat and move the chair. That's cheating. You want to move yourself to the side, okay? So you don't want to cheat. Now, just like those inner thighs when we were laying down or sitting, it's the same thing. You can still open, and you can open and close. It's the same move. It looks kind of weird, but it works. Remember the Thigh Master used to be able to push right here, open and close? It's the same thing without the Thigh Master. So it works, but any exercises, you just have to do them. Just do the exercises. Now, you can also do like toe marches, like individual. You can do them together. You can also do your arms while you're doing your marches. You can do lifts. You can do lifts one by one, or you can do them together. Remember, always hold your ab in and keep your back to the back of the chair. Always, okay? Now, you can always do the little trusty scissors, right? You can always do that. You can always do like what I call 3 points, because you know you're going to bring it up, you're going to let it out, you're going to bring it back, and then you go down. So you can do that too, depending on what your knee problems are. So you can do that too. Now, another little trusty one that nobody has no excuses why not to exercise is the little peddler. I wore one out. This is my second one. But now they got some new ones out. They have a little speedometer on it, but they have like a whole shoe where you can just put your whole foot in there and you don't have to worry about the pedal. And it makes it easier because after a while, this one can cut off your circulation a little bit. That's if you go an hour or more. Now, if you have restrictions, you want to make sure you push it out further. If you don't, then push it in closer. And you can change the tension on the little dial to make it harder to pedal. So when you're watching Power or all these crazy lies that Trump is saying on the Corona update, whatever news, whatever you want to watch, you could be pedaling. And before you know it, you've done 30 minutes. You've done 45 minutes. Your favorite show, like the Have and Have Nots, Loving You Wrong is coming back on. Any of the superheroes or MacGyver or Superwoman, Flash, any of those things you can watch while you pedaling and you're exercising. You can also get your arms involved while you're pedaling, right? So you can do that too. And the kids love this little peddler because it's like a bike, but it's on the floor. So you and your kids can exercise together. You can take turns doing your pedaling and everything. Now, back to the coronavirus. Now, I want you guys to stay safe. If you know as nurses, there's an assignment that you know is dangerous for your health, your patients, and your community, then you have the right to refuse under Cal OSHA standards. They have to provide you with all the appropriate PPE. And I do mean all. Your gown, whether they're investigating a corona patient to see if they have it or not, or whether they have it. You still need the same protective equipment. You need the N95, which should be fit tested for your face because there's different sizes. You also need gargles. You need gloves, and you need a gown or a jumpsuit is even better because it covers your neck. You also need a face shield. So if you're taking on assignment and you know it's not safe, then you need to state that. You need to stand up and say, this is not safe per Cal OSHA and per any guidelines, the WHO, everybody. You need to state that it's not safe. And you know when it's not safe because you feel that. So them giving you a surgical mask, you know and I know that that is not going to protect you. So that doesn't help you. Now, if you don't have anything, I wouldn't say something's better than nothing, but you should be having an N95. And this is the problem that's been going on, is that these administrators have been endangering our nurses and healthcare workers for months. And unfortunately, like I said, Mr. Kelly died last week. So we're trying to stop nurses and providers from dying. And we can become super users, meaning because we're going from patient to patient with different germs. So when we do get sick, we have more viral particles in our system. So if we do get sick, we tend to get sicker than anybody else. So they should protect us, and you guys need to stand up and unite and say, hey, I can't take this assignment. I respectfully decline because of Cal OSHA guidelines that this is not safe. This is an airborne disease. It's not droplets, it's airborne. It happens when you talk, when you exhale, while you're talking, when you sneeze, when you cough. Also, when their particles get on surfaces, you touch your face, your eyes, your nose, and you can get it. And the main reason why reusing of N95 is not appropriate because the germs stay there and do not the shift. You know, this stuff gets hot. Come on, nurses, we know it gets hot. So you tend to rub and touch your face because you're sweating, right? And then when you're sweating, there's salt there and it itches. So you're going to do stuff to your face. So you have to make sure you stay focused on not touching your face. Okay, that's very important for you and your family and your community. So hopefully, I'm praying every day that we get in the proper protective equipment that all of our nurses and healthcare staff needs so that we stay healthy, so we can take care of our clients and our patients, because that's what nurses do. We want to take care. That's why we went into the field. But our administrators have to make it feasible for us to take care of our patients and our clients. Meaning you need to protect your healthcare workers by giving us the proper PPE. So next week I'll give another update and I'll give you some numbers on how many of us is actually getting the coronavirus and some of us that are actually unfortunately dying. So tune in next week for another update. Stay safe, and I'll see you next week. You can contact me at marquita.com or healthyliving.company. You can also contact me and T Jams, the producer, here at Next Level Entertainment Studio at 310-549-1113, 310-549-1113. You can also contact T Jams, the producer, tjamzmusic.com. Send him a message as well. Okay, so I will see you guys next week. Stay safe, wash your hands, Keep social distancing. Reinforce social distancing. Wash your hands. Clean your products. Stay safe. All righty. See you next week. Bye-bye. Okay, so you guys don't forget, eat healthy, eat zinc products, exercise, release stress. Best thing to do. Bye-bye. See you guys next week. Take care of yourself. Wash those hands. Okay, bye-bye.